Hello and welcome to the Partnering with Iowa Total Care to Improve Maternal and Neonate Health presentation. Before we get started, let me introduce you to your presenters. My name is Kim Terrell. I'm the Manager of Provider Engagement at Iowa Total Care. We also have Dr. Paul Mulhausen, our Chief Medical Officer, and Patty Anderson, the Manager of the Start Smart for Baby program. During our presentation, we'll outline the purpose of the presentation, provide an overall summary, and then discuss our analysis of outcomes and our recommendations. Iowa Total Care is committed to decreasing barriers to prenatal and postpartum health care, thus improving maternal and neonatal health outcomes, along with birth outcomes. We want to identify social determinants of health and any barriers to care that facilities and providers may be identifying. We want to increase awareness to our Start Smart for Baby program. We'd like to increase the number of pregnant members with prenatal visits within the 13th week. We'd like to increase the member and provider notification of pregnancy submission and receive them as early as possible in the pregnancy. And of course, we want to increase the awareness of our access to care resources available to our members. As you may already know, 1 in 10 infants born in the U.S. are preterm. Babies born preterm at low birth weights can experience severe health and developmental difficulties, such as blindness, obesity, and diabetes. Pregnancy-related complications can be reduced by increasing access to quality care. Early notification of pregnant members and their risk factors is key to better health outcomes. Our Start Smart for Baby program incorporates the concepts of care management, care coordination, disease management, and health education in the effort to improve the health of the mother and their newborns. For Iowa in 2018, there were over 37,000 births. 42% of those births were covered by Medicaid. Almost 30% of those deliveries were C-sections. This is up 3 percentage points since 2005. And almost 10% of all births resulted in a NICU admission. So March of Dimes has identified 3 barriers related to NICU admissions in Iowa: poverty, being underinsured, and receiving inadequate prenatal care. It was also noted that Black women have a 33% higher incidence of preterm birth than any others in Iowa. One way we can address and overcome those barriers is through our notification of pregnancy. The notification of pregnancy form identifies pregnant members, it collects risk information, and it automatically enrolls each member into the Start Smart for Baby program. Although we can identify some pregnant members through claims data, there are 3 main things an NOP provides that claims cannot. A due date. This helps us prioritize the interventions to the appropriate stage of the pregnancy. Medical and social risk factors that haven't been coded on the claims. And it also provides us with updated contact information. Our preliminary data suggests that almost 25% of the time, the addresses on the NOP are different than the ones on the eligibility file. Iowa Total Care has member and provider incentives for those notification of pregnancy submissions. For providers, the incentive is based on accurate, complete, and timely Iowa Total Care notification of pregnancy form submission. If we receive that notification within the first 12 weeks of pregnancy, the provider has earned a $100 incentive. If we receive it between 13 and 28 weeks of gestation, $50, and then 29 plus $25. Not only does the NOP help Iowa Total Care develop the most effective maternity management program for each member, it also triggers the member's incentive. Dr. Mulhausen?
Thanks, Kim. I want to spend a little time sharing with you what we know about our Start Smart for Baby maternity management program and the outcomes that we expect from your patients' participation in that program. And I want to start out by highlighting that we know from fairly rigorous study that our Iowa Total Care Start Smart for Babies program has a meaningful and significant impact on important birth outcomes. The relationship that's most clear is shown here. across our sister health plans, there's a consistent relationship between higher notifications of pregnancy rates and lower rates of low birth weight members. So you can see here on the left-hand side of this graph, as our notification of pregnancy rate goes up, in our membership, we note a fairly consistent relationship in which the percent of births that are under 2,500 grams goes down. The point being that the intervention works and that we can actually partner with you and partner with your patients for better care for the moms in your care. Next slide. Our local data set is very young. We've been in business now for nearly a year, but less than a year. And the data less clearly communicate the relationship I just shared with you. But this slide and the following slide show the kinds of data we have, ways we can display it, and trends that we follow. And here, for instance, you can see since we really went live in July or so, we've experienced a gradual improvement in the rate at which we've been able to identify pregnant members through our notification of pregnancy program. And you can see there's a hint there that there is some improvement in the rates at which our babies are born at gestational age, at least 37 weeks. And you can see there's a hint there of some improvement in the rates at which our babies are born at a healthy weight. So we're starting to see the trends that we would predict based on our national analysis of the Start Smart for Babies program. And most importantly, we can share these kinds of data with you. So our next slide illustrates more information that we have available to us, trends that we follow, and information that we can share in your efforts to deliver high value care. So here is what we've observed so far regarding level 3 and level 4 hospital newborn units, both the rates of use that you can see here in the blue, and then as well as lengths of stay, which you can see here in the yellow. And interestingly, our NICU utilization rate seems to hover somewhere between 13% and 18%, and average length of stay is somewhere between 2 and 3 weeks. So we have these data. We want to share these data with you. We work very hard to make sure the data are of high fidelity and of value to you in your effort to deliver high value services, and we want to work with you in partnership to help us all be the best that we can be. Next slide. And Patty, I turn the podium over to you.
All right, thanks. I think I'll just start by giving you an overview of who my team consists of. We have 11 case managers who are all nurses and specialize either in OB or NICU. We have 2 program specialists who are social workers and 2 program coordinators who help with outreaches and resources for each county. So when the provider sends in the notification of pregnancy, which is on the provider portal, or the member sends one in through the member portal or via mail, it is risk stratified to high, medium, or low, depending on how the questions were answered, whether they have pregnancy complications or if there are social determinants of health. I will assign to a case manager who reaches out to the member to enroll into our program. Depending on their needs, they are called weekly, biweekly, or monthly. We outreach to all members who complete an NOP. The case manager will develop a care plan that is individualized to meet the member's needs, and the providers are always sent a copy of this care plan so that they know what we are helping the members with. Many of our members have social, behavioral, and substance abuse risks, and we work closely with our behavioral health team at Iowa Total Care to identify those needs in pregnancy as well. Next slide. This slide just outlines how we first risk stratify the member, then we develop the plan with the member and start active case management. We usually follow the member throughout the pregnancy and up to their postpartum appointment. The NICU babies are followed up to 1 year after birth to make sure they are meeting their developmental milestones. Our goal for the NICU babies is to help moms stay healthy during the pregnancy, hoping to reduce the risk of NICU admission in the first place. And our goal for the baby, once the baby is in the NICU, is to connect with the mom, answering any questions and making sure that she has what she needs after the baby's discharged. Once the baby's discharged, we work with mothers to attend appointments, understand the baby's needs, and ultimately try to decrease the needs for readmission. So this next slide is my favorite slide of all, because it talks about a real life case and a good example of how Iowa Total Care and our case managers really help our members, your patients. This member had a history of 2 preterm deliveries, and she is now pregnant again. She is advanced maternal age and was identified as having multiple barriers. She recently lost her job, did not have the money to buy baby supplies, and had no vehicle to get to her appointments. Our case manager facilitated transportation to help her get to her appointments and the infusion center for the 17P injections through Access to Care. She was given information on how to connect with workforce development, where she was able to fill out an application for employment and did find a job. The case manager assisted her with enrolling in the local WIC program, which qualified her to receive a breast pump for free after the delivery. And in addition, they connected her with the local Title V program, who assessed her dental needs, provided counseling, and found her some baby supplies. A SNAP application for food assistance was completed, and then education offered throughout the whole pregnancy regarding smoking cessation and what to expect in each trimester of her pregnancy. In working with the member, it was also found that her son could benefit from case management and was referred to a behavioral health case manager. This member went on to deliver a very healthy baby at 37 weeks gestation. So a great outcome for this member and her family. And this is only one story. There are so many stories I could tell you if we had the time. So we want those NOPs to keep coming in because we know that we can help make a difference with this program. Back to you.
After hearing such wonderful new information about birth outcomes for that mom, we want to ensure that our moms are getting in for that postpartum visit between the 7 and 84 days post-delivery. By completing the visit, the mom can be assessed for postpartum depression. Family planning can be addressed, which promotes optimal birth spacing, which will improve the next baby's birth outcome. Our Start Smart for Baby program outreaches to mom and educates on the importance of that postpartum visit, as well as answers any questions that mom might have, provides resource and referral information, and completes a wellness survey. Some of the resources that are available to our members are non-emergent transportation services that get that member and the baby to their appointments. We also have our My Health Pays program. It's our member receives money on their Visa card for completing healthy behaviors like that pre and postpartum visit care or the notification of pregnancy like we talked about earlier. It also gives them rewards for taking that baby to their well child visits. We also have resources available to get a free prepaid cell phone. Dr. Paul?
Thanks, Kim, and thanks, Patty, for describing so thoroughly the Start Smart for Baby program. My message to you here today is that we at Iowa Total Care truly want to partner with you. We want to partner with you to provide high-value care to your patients who are our members. We can help you and we can help your patients in a number of ways. We can provide support, education, coaching, counseling, transportation, and financial incentives to meet the requirements and the opportunities of good and healthy maternal care. The first step, the essential first step here in the first bullet point is to let us know when your patient is pregnant. Complete the NOP, the notification of pregnancy, and encourage your patient to work with our Start Smart for Baby case managers. Use the resources we have available to you on our Iowa Total Care website. Help us help you with some of the transitions that are experienced by the members who are new moms and their babies. Let us know when moms and babies are hospitalized. Our NICU navigators can help navigate benefit issues and help with transitions. Thank you for joining us today. Feel free to reach out to us with any of your questions, with any of the information you have, and with the notifications of pregnancy. If you'd like, request a live presentation from us. We like to get out and about and meet you. And we enjoy talking about the added value that we can bring to your care through our Start Smart for Baby program and other quality improvement programs that we have available to you. Thank you for taking the time today to listen to our presentation. And if you have any particular questions or looking for a way to conveniently reach out to us, please email us at quality@iowatotalcare.com. Thank you for your time.